Today we will discuss low platelet levels in a simple and easy to understand way. Have you ever wondered what leads to low platelet count in your blood test? Platelets are tiny blood cells essential for normal blood clotting. When their numbers drop, it's called thrombocytopenia. This can happen due to various reasons. Primary immune thrombocytopenia, ITP. This is where your immune system mistakenly attacks and destroys your own platelets. Drug-induced immune thrombocytopenia, DITP. Sometimes, medications like heparin or over-the-counter drugs can trigger this condition. Infections and other conditions, viruses like HIV, hepatitis C, or even bacterial infections can lower platelet counts. Other contributors include nutrient deficiencies like vitamin B12 or folate, liver diseases or autoimmune disorders, pregnancy-related issues. Conditions like gestational thrombocytopenia, preeclampsia, and HELLP syndrome can also lead to low platelets. What signs should prompt you to seek immediate medical attention for low platelets? A low platelet count becomes a serious concern when it leads to bleeding risks or is associated with certain conditions. Severe thrombocytopenia. If your platelet count is below 50,000, the risk of bleeding increases. Bleeding symptoms, unusual, bleeding like nosebleeds, prolonged bleeding from cuts, or excessive bruising should be addressed promptly. Coexisting conditions. If you're using blood thinners or have other blood clotting disorders, the risk is higher. Emergencies in pregnancy, HELLP syndrome, or preeclampsia with low platelets is a medical emergency. How do doctors get to the bottom of low platelet count? To understand the root cause of thrombocytopenia, doctors conduct several tests. Complete blood count, CBC, and peripheral blood smear. These tests give a detailed view of your blood cells and can point towards specific causes. Coagulation tests. These include prothrombin time and activated partial thromboplastin time, AP, helping assess clotting ability. Liver function and other routine tests to rule out liver diseases or infections. Screening for specific infections, tests for HIV and hepatitis C, as these can impact platelet count. Bone marrow biopsy. In some cases, especially in older patients or when other tests are inconclusive, a bone marrow biopsy might be necessary to diagnose conditions like myelodysplasia or leukemia. Be sure to follow up with your healthcare provider for the next step.